Welcome to a new episode of Norway Perspectives, brought to you by Norway Relocation Group. Today, we're diving deep into a system that every single person living in Norway will interact with, often within their first few weeks, the national healthcare system. More specifically, we're going to dissect the intricate process of getting medical care, how to navigate appointments, what is expected of you as a patient, and where the most common, costly, and stressful mistakes are made. Norway's healthcare system is renowned for being public, efficient, and highly digital. But it is built upon a fundamental pillar of Norwegian culture, a powerful combination of social trust, digital self-sufficiency, and profound personal responsibility. This is fantastic news if you understand the rules of the game. It means you have access to excellent care and a system designed to support you. But if you don't understand these unwritten rules, the consequences can be more than just inconvenient. Missing an appointment, failing to choose the right doctor, or simply not checking your digital inbox can lead to unexpected bills that escalate quickly, critical delays in care, and potentially serious health complications down the line. Let's explore how this system truly works, what is expected of you, and how to avoid the most common pitfalls that trip up even the most organized newcomers. Choosing a fastlege. Why this is your first, non-negotiable medical step in Norway. Your journey into the Norwegian healthcare system begins with one crucial, foundational action: choosing a general practitioner, known as a fastlege. The entire primary care model, the fastlegeordningen, is built around this concept. This doctor is not just a physician you see when you're sick. They are your designated partner, your main point of contact for all non-emergency health issues, and your mandatory gatekeeper to the rest of the specialized healthcare system. This is not an optional step, like choosing a favorite coffee shop. As a resident with a D number or a national ID number, fødselsnummer, you are entitled to a fastlege, and the system absolutely expects you to register for one. What many newcomers don't realize is the tangible consequence of inaction. If you don't actively log in and choose a fastlege yourself, the system may eventually assign one to you randomly to ensure you're in the system. This assigned doctor could have their clinic on the complete opposite side of the city, have poor patient feedback, or worse, have a full patient list and not actually be accepting new patients, leaving you in a state of administrative limbo. If you never complete this registration, you effectively have no primary doctor. This means every minor illness, every request for a prescription refill, every sick note, psych melding for work, and every single referral you need for a specialist becomes a complicated, stressful, and expensive ordeal. You will likely be forced to use costly private clinics, paying upwards of 1,500 kroner for a simple consultation, or wait for hours at the urgent care center, legevakt, for something your fastlege could have handled efficiently in a standard 15-minute appointment. To avoid this, your first task upon receiving your Norwegian ID number is to log into the national health portal, Helsenorge, using your bank ID. Here, you can search for available fastleger in your municipality, commune. You will see their clinic location, their gender, and whether their patient list is open, ledig, has a waiting list, ventelist, or is full, fullt. In major cities like Oslo and Bergen, many doctors will be full. If your preferred doctor is full, get on their waiting list immediately. It is far better to be on a waiting list for a good doctor near you than to have no doctor at all. How appointments work. Digital responsibility starts here. Once you have a fastlege, you are expected to manage your relationship with them independently. This is where the system becomes very Norwegian. It is overwhelmingly digital and self-managed. Forget picking up the phone to book a routine appointment. Most bookings, cancellations, prescription renewals, and even simple medical questions are handled online through Helsenorge. Or the specific clinic's own digital portal, which might be an app like Patient Sky or patients killed. This is where the concept of patient responsibility becomes critical and financial. If you book an appointment and fail to show up, even if it's due to a simple misunderstanding or forgetting to write it down, you will be charged a no-show fee. This fee, typically between 250 and 400 kroner, will be sent to you as an invoice or factura. The same fee applies if you cancel too late, which is usually within 24 business hours of the appointment time. If you don't pay this invoice, or if you don't regularly check your mandatory digital mailbox, either Digipost or e-box, where these official communications are sent, the bill will escalate. It will be sent to a collection agency, or incasso, with significant additional fees that can triple the original amount. Unlike in many other countries, you will not receive multiple friendly phone calls or text message reminders. The system presumes you are an adult who manages your own calendar and finances. The responsibility to remember, attend, or cancel in time is yours alone. When you need a specialist, referrals are required, and waiting times can be long. While Norway has universal healthcare, it operates on a strict, hierarchical, referral-based system. You cannot simply decide to see a dermatologist for a skin issue, a cardiologist for a heart concern, or a physical therapist for back pain. Your fastlege must examine you first and agree that a specialist is medically necessary. If they do, they will write you a referral known as a henvisning. Here's where things can go wrong for newcomers. If you try to book an appointment with a public specialist directly, without a henvisning, you will be politely turned away or told you must pay the full private price, which can run into thousands of kroner for a single consultation. Furthermore, if you delay contacting your fastlege when your symptoms first appear, you are starting a chain reaction of delays. Once you finally get the referral, you will be placed in a queue for the specialist. For public specialists, these waiting times can be long, from a few weeks for something pressing to many months for non-urgent issues, like a minor knee problem or non-cancerous skin lesion. Your referral also has an expiry date. If the specialist clinic contacts you to schedule an appointment, often via a letter in Helsenorge or Digipost, and you don't respond or miss the given appointment, your henvisning may be voided. This could mean going back to your fastlege and starting the entire months-long process all over again. Be aware that you have the right to fritt sykehusvalg, free choice of hospital, meaning you can use your referral at any public hospital in the country. You can check waiting times on Helsenorge to find a faster option if you're willing to travel. Prescriptions and medication. The role of the e-prescription system, e-recept. In Norway, paper prescriptions are a relic of the past. The system is entirely digital through a database called e-recept. After your appointment, the doctor enters your prescription directly into this national system. To pick it up, you simply go to any pharmacy, apotek, in the country, state your name and birth number, fødselsnummer, and show your ID. The pharmacist will see all your active prescriptions in the system. But if you're not aware of this, or you don't understand how long your prescription is valid for, you may run into trouble. For chronic conditions, you must proactively manage your renewals. You cannot simply call the pharmacy for a refill when you run out. You must log into Helsenorge and send a digital request to your fastlege for a renewal. The doctor may require you to book a new consultation before they approve it, especially if it's been a while. If you wait until you have one pill left, you may find yourself without essential medication for several days while you wait for the doctor to respond or for an available appointment slot. For long-term illnesses, it's vital to ask your doctor if you qualify for a blå recept, blue prescription. This provides significant government subsidies for medications and supplies related to chronic, serious conditions, dramatically reducing your out-of-pocket costs. Emergency versus non-emergency. Misusing the system comes at a high cost. Understanding the different levels of care is vital for both your health and your wallet. There are 3 distinct tiers. Fastlege. For all standard, non-life-threatening health issues during daytime working hours. This is your first and primary option. Legevakt, urgent care. This is the out-of-hours clinic for issues that are urgent but not life-threatening and cannot wait until your fastlege opens the next day. Think of a child with a very high fever that doesn't respond to medicine, a suspected broken arm, or an infection requiring immediate antibiotics. Akut motak, 113, hospital emergency room. This is for acute, life-threatening situations only. Call 113 or go to the ER for things like chest pain, difficulty breathing, symptoms of a stroke, or severe accidents. Using the wrong part of the system has immediate consequences. Showing up at the Legevakt or ER for a common cold, a minor prescription refill, or a long-standing backache will result in very long waits and a much higher bill, egenandel or copay, than you would pay at your fastlege. At the ER, they may simply refuse to see you and direct you back to the Legevakt or tell you to book an appointment with your GP. This is a system designed to protect precious emergency resources for those who truly need them. Children and school health services. Why you still need to follow up. For families with children, the public system offers a fantastic support network through the local health station, Helsestation, for infants and toddlers, and the school health nurse, Helsesykepleier, for school-aged children. They manage the world-class national vaccination program and regular developmental assessments. However, a common and critical mistake foreign parents make is assuming these services are a substitute for a fastlege. They are not. If your child is actively sick with an ear infection, a fever, strep throat, or needs any kind of diagnosis or treatment, you must take them to their fastlege. The school nurse provides preventative care and advice. She does not run a clinic for sick children. You must actively monitor your child's health journal on Helsenorge, respond to communications from the Helsestation, and ensure you attend all referred appointments. Missing key developmental assessments can delay crucial educational or medical support if a problem is detected. Language barriers. Why translation support isn't always guaranteed. In theory, all patients in Norway have a legal right to a professional interpreter, tolk, for medical appointments. In practice, this service must be requested by you or your doctor well in advance and is typically reserved for essential and serious consultations, not a routine checkup for a sore throat. If you attend an appointment and don't fully understand the medical instructions, the follow-up steps, or the details of a diagnosis, that misunderstanding is still considered your responsibility. Misinterpreting a medication dosage or failing to book a recommended follow-up test because of a language barrier can have direct and dangerous consequences for your health. Learning basic medical Norwegian or bringing a trusted, fluent friend to assist you is not just helpful. In many cases, it's a crucial element of ensuring safe and proper care for yourself and your family. What happens if you do it all wrong? The real consequences. Let's be frank. What happens if a newcomer ignores this advice? You don't register for a fastlege. You wait until a small health issue becomes a big one. You don't understand that your prescription needs a doctor's renewal until you're completely out of vital medication. You miss a critical message in your Digipost about abnormal test results. You assume the system will take care of you, and you continue to operate only in English in a system that runs on Norwegian and digital platforms. Eventually, these small mistakes accumulate into large, stressful problems. You overpay significantly for services you could have received for a nominal copay. You experience long, frustrating, and avoidable delays in receiving care. Your health and the health of your family can genuinely suffer. In the long run, these patterns demonstrate a lack of integration, not just linguistically, but in understanding and respecting the fundamental systems of your new home country. What you can do: be proactive, not reactive. If you're unsure about how the Norwegian health system works, don't wait for a medical issue to force you to learn under pressure. Be proactive. Log into Helsenorge. Know today using your bank ID and choose your fastlege. If the best ones have waiting lists, get on one. Familiarize yourself with your doctor's online booking portal. Understand how to book, cancel, and request prescription renewals. Make sure you have activated and can access your digital mailbox, Digipost or e-box, and check it at least once a week. Take learning Norwegian seriously, especially the vocabulary related to health, appointments, time, referrals, henvisning, and digital messages. At Norway Relocation Group, we help newcomers master these essential systems. From guiding you through Helsenorge registration and helping you find the right fastlege, to explaining your rights as a patient and preparing you for medical interactions, we're here to ensure you navigate the system with confidence. And if you need practical language training focused on medical vocabulary, reading letters from the hospital, or using digital health tools, our partners at NLS Norwegian Language School offer courses built for the realities of life in Norway, not just textbook grammar. Thank you for listening to Norway Perspectives. We'll be back soon with another episode, helping you avoid costly mistakes and build a secure, confident life in Norway.